I'm Christian Barnard. One of the country's top cardiologists says half the people who die suddenly from a heart attack have no prior symptoms. A calcium scan can be a game changer because it shows exactly how much calcium is or isn't blocking your coronary arteries.
% of people die of a heart attack or stroke. So let's find out before you have a problem if you're at risk, and let's do something about it.
Dr. Goodman says people are usually asymptomatic until their arteries are 70% blocked, so you need to be proactive.
Most patients are not at that level. They've got plaques or they've got blockages that are less than 70%. They will most likely be asymptomatic. How do we screen those people? Calcium scanning is an excellent way.
The calcium scan will reveal your age based on the health of your arteries.
If you land up with somebody maybe 50 years old and they've got a lot of calcium, they could have arteries looking like someone who's 60 or 70. If you're 50 and you've got very low calcium, you can feel good. We would say, you know, your arteries look 10 years younger than your biological age.
The calcium scan only takes a few minutes. Dr. Goodman says if you have high cholesterol or other risk factors, you should consider it.
Got a family history, hypertension, diabetes, metabolic syndrome, smoking, overweight, a lot of stress. These are major risk factors.
Dr. Goodman says scans should run around $100. They're not covered by insurance, but they do give very good information.
There's very often times we're trying to decide should you or shouldn't you be on a statin. And the calcium scan helps me to decide on whether to put somebody onto a statin drug or we can use a more natural approach or lifestyle changes.
There is a little bit of radiation with the scan, so Dr. Goodman says it is not for those with a history of cancer or those who have been exposed to a lot of radiation. Otherwise, he says it is worth the risk. See you next time. Christian Barnard, Time Warner Cable News.